So here we are. Good morning. It's Nikki from Nurses.co.uk. Good morning. It's Nikki from Nurses.co.uk because we are recording. And today I am speaking to lovely Janet. And Janet is a second-year student nurse. And the idea is that over the next year, we're going to follow her journey on different topics as she's going through her training, and just get to know her, sit and have a cup of tea and a chat with her in various places. So yeah, how are you, Janet? Hello.
Hi, I'm great, thank you. Doing really well. Can't believe we're at the end of January already. It's like, where is the year going? It always just doesn't January take so long, and then the rest of the year just flies by.
Yeah, no, it's been a little bit of a crazy time. I was going to say to you actually, just thinking about how crazy it has been. Unfortunately, I lost my father last week. He passed away really unexpectedly. And I really wanted just to share it with you because I know we're getting to know each other really well. And yeah, I wanted to kind of give you my insights from a more of a kind of clinical point of view, and how that felt. I hope that's okay with you.
Absolutely, yeah. I'm really sorry to hear that.
Oh, thank you. Yeah. And I think the other thing as well is that I'm really mindful that when we first started talking, you shared with me that you have an interest in palliative care yourself as a direction that you'd really like to go. And I think obviously your personality and everything lends itself to that. So I just really wanted to share my thoughts on it. So very sadly, he became ill very quickly, and it was evident that he had an awful lot of cancer throughout his body, and that he wasn't going to last very long. So with his wishes, they sent him home. He luckily wasn't in any pain. He's always been a very focused, determined man, really robust, great personality, and will be missed by many, many people. But he was very restless. He came home with oxygen, and I knew fairly instantly as soon as I'd known what was happening, and once he got his diagnosis, that he wasn't going to be with us for very long. And actually, as I reflect back on it, you would never ever have known that we were in a pandemic through his care and attention, because once I'd got blood tests organised for him with his GP the next day, from that moment on, he had non-stop tests booked instantly, no waiting, straight in. And then in his final week, I suppose, he had been admitted to hospital, and then eventually onto a side ward. So up until that point, only my mother could visit him, but then I could. And then he came home, which was his wish. And we had so much incredible support from Sidmouth Hospice at Home. They're a charity that's referred through the RD&E here in Exeter, and they were just the absolute salt of the earth. There's 4 or 5 of them in the team. Couldn't have done more to support my father, my mother, and me. And that's the bit I kind of wanted to share with you, Janet, because it was a really interesting position to be in, challenging actually is probably a better word, to be a nurse, excuse me, looking after my own father. I'd never been in that position before. I've had the privilege of being with many, many people over the years at their end of life, but never my own family, or indeed my father for that matter. So, excuse me, frog in my throat. So it was really strange, because he came home with just in case medications, and although he wasn't in any pain, he was very agitated and restless. And I had that conversation with the nurses that rather than them coming out in the middle of the night, I would be happy to deliver that medication to him. And then they very gently and professionally advised me not to do that because it might have lots of different implications, and they actually just wanted me to be the daughter and not be the nurse. And for that, I'm particularly grateful to them, because yeah, that was just a whole new insight for me. But I just felt so proud to be a nurse and to know that they were there doing their job so well.
Yeah, that's an amazing story, isn't it, really? I mean, even though you've been a nurse all those years, to now be in the position of being the family member, you can't understand really what it's like from somebody else's position till you're in it. Empathy is a great thing, but first-hand experience of seeing through those eyes really does give you a different perspective on things, doesn't it? But those nurses that you were working with, or that were working with you, they've clearly got a bit more of that perspective through massive amounts of experience. So, and this is what I'm really passionate about with nursing, is that you've got that kind of relationship with patients and with family members. It's really deep. And they establish that really quickly because they've developed those skills really well. And this is the kind of nurse that I want to be. I thought very long and hard about it, and it's taken me, I'm 48 now, it's taken me 30 years from being 18 and thinking that I wanted to be a nurse then, but knowing that I wasn't ready. It's taken me till now to actually pluck up the courage and do it. And it's only now really that I feel like I've got those people skills to bring to the job, and for me that's pretty key about what nursing's about when we're trying to define nursing. And it's a really hard thing to define, and we haven't managed to define it yet. Maybe it's a personal thing that every single nurse has got a different definition of what they are. But for me, the nursing role is about providing a level of knowledge, but much more than that, providing that kind of relationship that those nurses very quickly established with you in a short space of time. For me, that's what it's all about.
Absolutely. And that's a really interesting thing to say as well, because, yeah, I believe that every nurse is on their own journey. And I know we've both had discussions previously about the kind of intergenerational effect of nursing, and how wisdom and knowledge plays a really important part in coming into nursing at a later stage in your life. And I would say that, just thinking about that Sidmouth Hospice at Home team, the majority of those wonderful women were actually in their 40s and beyond, more in my age as well, and I'm in my late 50s. So, and they also had, they did actually bring with them an urgent response team as well, a couple of girls that were much, much younger, but they were just, again, it's kind of the energy that people give out. So regardless of their age and their expertise, it's kind of more that they were the right fit for the job. And again, absolutely gorgeous, gorgeous girls that you just felt like you wanted to have hugs with people, because that's what they gave out. So it's quite interesting to me, actually, reflectively, that the majority of the team was slightly older. And just based on what you're saying, I'm wondering if you arrive at that place in palliative care because of life experience, like you say, possibly. But you've already determined that, and as I said to you before, you've got all the characteristics and qualities to be a wonderful empathic nurse. The bedside part is so important. It's very rare to get that connection with people, and I do think that is one of the most beautiful points of being a nurse. Because not all kind of clinical and medication, it is actually making that connection with people. So that's really lovely. Yeah, thank you for letting me share that. I just felt it was important, because I know how interested you are in it.
Yeah.
Anyway, moving on a little bit from that, I just just enjoying our tea. We've got to come up with a name for this, and we just need to tell folk what we're actually planning to do. So it's going to be once a month that Janet and I get together and have a good old natter, basically, about all the important things. But we're trying to put a little bit of structure around it, Janet, aren't we? So like, for example, next month we're gonna be on a really juicy topic, aren't we, about how well-being and self-care is so important in sustaining your ability to be a really great nurse. So that I'm really looking forward to that. And then I think maybe the month after we will be looking at the impact of COVID, because it will be 2 years then since this huge life-changing thing came into our world.
Is that all? It feels
Yeah,
like 10.
Yeah, God. So, and we've got a lot to say about those, but let's just focus on today. And I really wanted to talk to you about your placements that you've got coming up and how you're working within your placement and the choice that you've made with your additional work. And I wanted you to just share that with our audience, because this is really interesting too.
Yeah, so I do a lot of placement work with the university. We have 20 weeks over each year, and I've had really varied experiences. I've been in endoscopy, I've been on the spinal ward, I've been on a CDU ward where patients were much more in and out. I did a bit of coronary care and I did dialysis. So very varied, and each one gave me something different and was challenging and interesting and fabulous. But when we finished more or less our academic year, I found myself with quite a nice chunk of time where I could do some NHSP work, NHSP being a kind of an agency where I can choose which shifts I want to work, and I work as a care support worker for them, and I've been working in the hospitals in South Yorkshire, and it gives me access to pretty much every ward in the hospitals. Anytime they're short of staff, they put the shifts onto an app, and I can just select the ones that fit in with the times that I want to work. They fit in with the days. They're shorter shifts, which is important for me. I don't especially want to work 12.5-hour shifts all of the time, which is what I do during my nursing. But shorter shifts should suit me great. So NHSP does that.
So do you mean, when you say shorter shift, do you mean a 6-hour shift?
Yeah, they are. Sometimes there's even shorter ones than that, although you do kind of lose the point of like a 4-hour shift. Is it really worth it? But there's not many 4-hour shifts, but there's a lot of 6-hour shifts, and there are the 12.5-hour shifts as well. But I suppose the point really is that it's choice. It's if you want to do the longer shifts, they're there, but if you need or want the shorter shifts, then they're there too. And that's what I really love about the NHSP. And one of I don't want to push NHSP because they can do that for themselves, but one of their selling points, their claim is to be able to provide people with more flexibility around the way they work. So if the things that are putting people off nursing is longer shifts, then they're saying don't even take a job as a nurse, work through NHSP. You know, it doesn't have to be an add-on to your work. You can base your whole working life around NHSP, because they do it for nurses and they do it for doctors as well. It's not just care workers, and every profession has got the ability to work through NHSP. I think like physiotherapists and all sorts of people.
Technicians.
So,
and
and it's just giving people more flexibility, whereas traditionally in the medical fields, there does seem to have been that perception that it's set hours, it's arduous, it's very intensive. Whereas with the NHSP, because you've got the choice yourself, if you choose not to take any shifts in a week, then you've got a week off. There you go. But for me, that's
amazing. And like you say, we're not necessarily advocating for NHSP here, but I just wanted to add that being totally transparent, this is just the way it is. You and I have had this conversation, and when you said NSHP, I thought, What is that? And the P, by the way, for our audience, stands for professionals. And kind of shockingly, to be honest, I had never actually heard of them. And I had previously, in my lifetime last year, worked for an agency as their lead nurse here in Devon, and I had never even come across NHS professionals. So the way that I see it working is that the shifts go to you guys first, and they pride themselves on that. So it's kind of snappy, quick. There is a lot of flexibility built in. And if they can't fill those slots, they then put them out to agency. So that they are kind of like the bank for NHS. They are, I believe they're actually their own health authority, and they're through the Health and Social Care Secretary looks after it. I think in order to be a healthcare assistant, you have to have at least 6 months and have a level 2. But I just wanted to ask you about that, because I'm really interested for you as a second year student nurse, knowing you as you are, you wouldn't not say that you are. So I'm just wondering how you're perceived, how you're greeted with the thought that you are a second year nurse, because obviously not everybody will be in that situation.
No, and I always, when I go onto a new ward, I say that I have just completed my first year, and that first of all, they're always grateful to see us, regardless of whatever else, because some of the wards are just so short-staffed and the staff are so tired that they need new legs. And when they get NHSP, they get new legs. So they're always really grateful that we're there, which is really lovely. And of course, we know nothing about the wards, so it takes us a little while to acclimatise and to find where the equipment is and all of that. And everybody is really helpful with all of that. Which is great. But I do also say that I've just completed my first year, so it gives them an idea of what I do know. And obviously soon, it won't take long before I'm able to say I've nearly completed my second year, and that's another step up really in the skills that you've got. And so they know that I'm familiar with wards, that I've got the basic set of skills to do with observations and talking to patients and turning, and that's a lot of the work that we do with as care workers. It's personal care. So yeah, they've always been really positive about the fact that I'm there as NHSP, but also that I'm a student nurse as well.
Yeah, no, that's good. Janet, I'm really interested that when you go into a scenario, let's just say you've been on that particular ward for a little while, but you go into a handover, for people that don't know, I'm sure everybody does. That's when, maybe the night staff are handing over what's happened during the night, or any changes with patient care generally. Do you feel that those that are leading you and are in charge of you during your shift do a really good kind of recce on the skill mix that's there in front of them for the day? Do you think that's part of the process on delegating different patients? Do you actually feel that people take that into account?
Do you know what? I'm not sure that they do, to be honest, because at the moment the situation is you've got the people you've got, and you may not know anything about those people. Just from my experience, the I was on a ward where it handover this is the nighttime handover. They were the recce that they were doing was on the numbers of bodies that they had, and they were busy trying to work out whether they had enough staff to operate safely on that ward. Now, I'm not saying that this happens all the time, but just because of the situation that we're in now, with people having to isolate and all that stuff, it really was a little bit of a strategic thing about who's here. And where, if we haven't got the numbers, where are we going to draft them in from? They were waiting on phone calls for, could we get a nurse from another ward, because there weren't enough nursing staff. So and I imagine that that wasn't always the case. That you used to have a team of people who you knew them, you knew their names, you knew how long they'd been on that ward, you knew their skill set, but that isn't the case right now. What you've got is a lot of it, and even the nursing staff, some of them are NHSP too. I was on a ward the other day where two of the nurses were both there picking up extra shifts, so that it was a new ward to them as well. So it wasn't possible for the handover staff to allocate based on each other's strengths because they didn't know each other. And yet that ward managed perfectly well. It was run effectively. We all knew what we were doing. We all knew our jobs and were quite capable of them. And we got through the shift and we learned from each other and we learned about each other, and it was really lovely. But I think that isn't the model that the NHSP was operating under 4 or 5 years ago. Maybe it was 3 years ago. Maybe some of the things that we see now aren't necessarily COVID related. Maybe there was kind of changes in the air before that anyway. But that's the situation we're in now, where you sometimes you're cobbling teams together to meet the safety numbers and to get through a shift. But those people are still absolute professionals that they always were, and the patient, I don't think the patients necessarily notice that it's not the way it quite should be. I don't think they notice that at all.
Yeah, well, I mean, hopefully, without a shadow of a doubt, within your nursing career moving forward, that will come back in, and you'll be you yourself as a leader will be, looking at how important that is to deliver optimal patient care, just having that skill mix. But I totally understand with the current situation, but it must just feel like a real result when you get to the end of the shift and everybody's fine, everybody's happy, because like you say, it's there's a lot of balls in the air at any one time, and I would imagine your patients have no idea of how that's being orchestrated.
Yeah. In some respects, I have never met a bunch of people who are more capable of being problem solvers than nurses. A real strength is nurses' problem solving skills, and you can spot a nurse. I can now spot a nurse a mile away, because if there's a problem and there's someone there to solve it, they will solve it, and that's it's just what we do. We don't moan about it. We don't cry. We come up with solutions, and that's a real strength. But in some respects, we can almost problem solve ourselves out of too many problems, and kind of actually it adds to your workload. If you solve all the problems, people think that it's fine. It'll just carry on. It won't fall down. It'll all get solved. And that puts a lot of strain on nurses and other staff, that they're always expected to solve the problems. But you have to solve the problems. You can't let things fall over. And that's what we do, is we keep things up, don't we? We keep all those balls in the air. If the balls ever fell to the ground, then that would be a real crisis point, and maybe that would be the time that really big policy decisions would change the fundamentals. So in some respects, I really admire our problem solving skills, but on the other side, as far as resilience goes, I think sometimes it can make us too good. Does that sound mad, or
no, not at all. No, not at all, because you have like a little process that you work through. But I think it's really important to have that. I mean, not wishing that on anybody at that crisis point, but let's just say that a ball did fall, or a problem hadn't been solved. I think the learning is just as important on the failure and the dropping of the ball. Like you say, that would open a pathway for a policy to be looked at again. Or if it was around safety and there weren't enough people on the ward that day, then that takes it kind of up levels everything to a different place. I mean, you and me and everybody else, we don't have the answers all the time. but it's really good to think that, you know, in your scenario, that you would be part of that problem solving process, regardless of where you are in your training. You just add so much value to the scenario. That actually leads me to ask you, Janet, I mean, it's a personal choice, I recognise this, but there will be people on your course that for whatever reason have chosen not to do agency or NHS professionals, and they must be at quite a disadvantage in comparison to you and your other colleagues not doing that.
I guess so, because I'm clocking up hours all the time, which for me is really important to be able to do that. But as well, I think just the fact that if people choose not to do NHSP, is that because they've got families? Is that because they've got other things going on and they're getting life skills from those things, which is what I've been doing for the last 30 years. You know, my previous experience isn't in an NHS setting at all, or a care setting. And yet I feel like all of the jobs that I've had have got something to contribute to what I can bring to the table now. So yes, it definitely, doing these hours definitely does enrich what I can bring to my degree and from there into my first job. But there's so many other ways to get that as well. And so long as people feel like they are able to use whatever experience they've got, then I think that's okay. But for me, it just seemed like a no-brainer, really. Even just absorbing, you know, the atmosphere of a ward, and the sights and sounds, you know, having all of that as a familiar thing around me because I've done it so many times now. That is a bonus to me. It helps me. I don't want to be in a working environment where I feel like I'm a little fish in a big pool. And of course, the repeat of the shifts it just gives you that familiarity for me that helps me feel at home.
Absolutely.
And the change, the regular pace of change, you know, that's an important thing as well. The resilience that you get from knowing that it's a new ward, I've got new things to learn, and because that can be a bit daunting when you're thinking you're going somewhere new, you don't know anyone, you don't know anything. Whereas I'm repeating that experience at least once a month. I'm going to a new place at least once a month. So you lose that kind of stage fright about new places.
That's so true. And, you know, clearly it really, really builds your confidence. I mean, I trained back in the dark ages, actually, oh my goodness. It's 40 years this year that I started my training. I feel like I was with Florence Nightingale, but yeah, 1982, and I absolutely know that none of us, that it just wasn't an option for whatever reason to do. Well, we didn't do the degree then for a start, so it was full time. So, but nobody, as far as I remember, nobody did kind of a top up on agency or whatever. But yes, you're so right. So many people find it such a daunting experience to constantly relearn and put yourself across in a new situation. And this takes that all out for you. You know, you've got that down. Amazing. Well, I mean, I think we kind of getting to the end of this one today, and I know I'm really looking forward to speaking to you next month. I just thought maybe we could give people just a little bit of a snippet, because it's something you're very passionate about, and I believe that you're considering maybe using some of this work towards your dissertation. But yeah, you've touched on it today. We'll always be touching on it. It's all around what we need to sustain us as nurses, to keep ourselves fresh, vital and current, and what that means. Did you want to say anything more about that, Janet, before we wrap up?
Yeah, because messages around well-being, they're a hot topic, aren't they? Mental well-being, physical well-being. There's a lot more out there than there used to be, and there's more of a recognition that nurses aren't robots, that they're people, and that things affect us. and we need to be healthy if we want to be able to maintain our careers and do a good job, and we've got lives outside of work too. But for me, a big thing is that sometimes we actually can self-sabotage ourselves through some of these messages as well, like going back to the idea of looking at other people's lives and thinking they've got the perfect life, and why haven't we got the perfect life? They're going jogging 6 miles before they even go to work and stuff like that, and they've got this perfect setup, and we kind of get sucked into that, especially with the way the media is these days.
Absolutely agree. Social media, yeah.
And we kind of get sucked into this idea that we've got to have this ideal situation going on, and if we want that situation we can do all these things. But actually, sometimes all these things are actually adding to the pressure on us. And over the last sort of 5 years or so, I've really been tuning into the idea that, yes, I want to be healthy, but I don't want to become a slave to the healthy tropes that are out there. They're actually doing the opposite. And so, especially around things like fitness and diet, a lot of the messages that we're given, I feel, are quite the opposite of what we should be given, and are actually making us worse and making us less healthy and putting more pressure on us to achieve something that we can't. And my message really is that there's a simpler way to be healthy that can work for everybody. And so that I kind of want to bring that into my dissertation, that we need to be healthy and there are things that we can do, but maybe it's not the things we're being told to do. Maybe it's something a little more kind.
Yeah, I so love that. I'm really looking forward to it at Nurses.co.uk. Everything that we do with our coaching program and moving forward, the thread of that all the way through, all wrapping around it, is always about well-being, because we want to be able to empower nurses and healthcare professionals generally to have the best things at their fingertips that work for them. And this is the key piece. It's not a generic thing. Everybody needs something different. And everybody also needs to feel that they are enough, whatever that is for them.
Yeah.
So it's kind of unpicking that and coming up with something that just is perfect for you. So I'm so looking forward to having that conversation with you. And that will be at the end of February, because we're doing it every month. So yeah, really looking forward to that. I'm going to stop recording very shortly, but I just wanted to say a big thank you, Janet, to you, and wanting to join us, over the next year. We're really excited about the journey with you. I think it's really important for our audience to know what it's like on the ground as a student nurse, and also to get to know you and to know why you decided to come into nursing in the first place, and what it means to you and what the future holds. I mean, it's just exciting. So thank you so much for your time today.
Oh, thank you. I get a lot of support from you guys, so I'm really appreciative of that.
All right, I'll speak to you soon. Don't go anywhere though.
I won't. Thank you.